Now, the Tshwane Health Department has launched a campaign to eliminate the mosquito infestation in Winterveld and Soshanguve. This initiative follows a series of site visits by the member of the Mayoral Committee for Health last year. Mosquito infestation has negatively impacted residents of these areas, causing discomfort and distress in their daily lives. The initial phase of the Eradication program involves utilizing drones to apply larvicide in Soshanguve. We get some clarity now as we speak to the City of Tshwane's Deputy Director of Municipal Health Services, Dr. Maretha van Der Merwe, for more. A very good evening to you. Thank you so much for your time. As a department, you continue with the efforts to deal with a mosquito infestation in the Winterveld and Soshanguve areas. I know this is a process that started last year already, following several complaints from residents. What have you established about the extent of this problem?
Good evening, and thank you very much for the opportunity. Yes, we've received a lot of complaints from the community itself in Winterveld, as well as some of the councillors there from last year, May, more or less. So we've opted, because we're working in a very sensitive area, there's a lot of wetlands, and I think you know the Tshwane crater involves a lot of watery areas. So we've engaged with a company to start application of an active ingredient called Bacillus thuringiensis, the subspecies Israeliensis. And this is the active ingredient that is bio-friendly for the environment. So we've started with phase 1, which was actually a little bit late. It's almost in the winter time. But we started with phase 1 to apply this active ingredient, and it's actually called Vectobac, in an area as big as between 4 and 5 hectares in the Tshwane crater area. This is more to the southern side of the crater itself. And the plan is to continue with phases number 2 and 3 later in the year, when we've received our yearly rainfall, and that we can actually see where's the areas where there's a lot of stagnant water, because those are the areas that we're going to target. So in terms of the application, it's for us as Municipal Health Services a first as well, but we are very excited. It seems that the effect is going to help us a lot to get rid of this problem in terms of the mosquitoes, and the fact that a lot of the community members are being harassed. It's irritation, and it's causing almost a type of a sickness in terms of the number of mosquitoes that are biting the people in that area. So the drone is
what kind of sickness are you talking about if you say it's causing a type of sickness, just to get a better understanding of the health impact?
The irritation itself, and also on immunocompromised people and small children and older people, a lot of mosquito bites can cause a fever, and it can cause a big distress in terms of the well-being of people. Okay. But we have established the fact that it's not malaria-carrying mosquitoes, but the reality is, in terms of the irritation, it causes a problem.
So as you work the areas in these phases, talk us through the scope of your work to eradicate the infestation. I mean, you speak about an active ingredient. How are you rolling this out? Are you spraying? What is the aim of your eradication? What are you trying to really do to rid the area of these mosquitoes?
So the biggest opportunity for us was in terms of the application, to actually send people on foot to go and do a spraying. We realized that it's not going to be as effective. So we've opted for a drone option, which is a very big drone, and it can carry up to 40 liters of the larvicide. And it can cover in a couple of hours, it can cover 5 hectares. So we've made a lot of planning prior to sending out the drone to identify specific areas that we wanted to spray the larvicide on. Now, how it works in practice is that it's a bacillus that actually attacks the larvae itself, and it causes the larvae to die. So in the control of any type of a vector or an insect is to break the life cycle in 2 different places. And in terms of the mosquito life cycle, the larvicide is the most vulnerable part of the cycle, as well then as the adult insect itself. So we've opted to do the application with the drone for the larvicide. It kills the larvicide with contact, and we've done a follow-up to see what the effect was. And up to now, we are very satisfied and comfortable that we can continue with phase number 2, which will be more or less in October 2024, where we will target the western side of the Tshwane crater, where the rivers, the South Spruit River actually feeds the Tshwane crater. And then going for the last phase, which will be towards December, the end of 2024, and again targeting the pre-planned areas after we've received our annual rainfall, so that we can see where's the areas where there's a lot of stagnant water. The mosquito larvae needs water to survive.
Yeah, and with that, we know that just about anything that can hold water for about 5 to 7 days is essentially the perfect place for raising young mosquitoes. As you talk about these phases, how are you going to measure the impact for, say, the impact of phase 1? How will you measure that it has become effective? Because it seems like the water, the stagnant water, is not going away. So how will you measure the impact of the work that you're putting in?
So we've done some footwork in terms of to identify places where we've observed the larvae, and then we've taken samples from that water to actually see whether it did what it was supposed to do and kill the larvae. So we've done a physical test on that. The planning is very important. We cannot waste the larvicide and the active ingredient over dry areas. So the planning phase is quite important before we send up the drone to start with the application. But coupled to that, we are planning from Municipal Health Services in the city of Tshwane to do a proper educational and awareness campaign amongst the community members, especially the school children, to educate and inform them in terms of very practical things that you can use not to get bitten by the mosquitoes, and also to try and not enhance the breeding places for the mosquitoes. As you mentioned just now, any areas where there's a little bit of water in the bottom of a tire or an old rusted can or something, everywhere mosquitoes can breed in there. So we need to educate the community in terms of how can they assist and eradicate places where mosquitoes can breed.
What about the environmental impact of the pesticides you're using? Is that not itself going to have another ripple effect of potential health risks as you spray and perhaps have a negative impact on the community?
Yeah, that's why we've identified this specific vector-back product with the active ingredient being a bacillus. It is a bio-friendly product, meaning that it's target specific. It will not affect the biolife of any other vector or organism or animals or human life in any way. And that's the main reason why we decided on this product, because we're working in a wetland, a very sensitive area in the Tshwane crater, as well as the catchment areas of the Spruit River.